Cheap health insurance in Mississippi. It is a fact that you may not know that if you cannot buy official health insurance from the government, you will need to find a private business that will cover Mississippi health. Cheap health insurance in Mississippi will guide you through what you need to know about this type of insurance. Health insurance classifications in Mississippi. Health insurance plans in Mississippi are typically classified into several categories based on their level of coverage and cost sharing. The following are the most common classifications. Bronze plans have the lowest premiums but the highest out-of-pocket expenses. They typically cover about 60% of medical expenses, with the insured paying the remaining 40%. Silver plans. These plans have slightly higher premiums than bronze plans but provide better coverage, covering approximately 70% of medical expenses and leaving the insured responsible for the remaining 30%. Gold plans. These plans have higher premiums than silver plans but provide better coverage, covering approximately 80% of medical expenses and leaving the insured responsible for the remaining 20%. Platinum plans have the highest premiums but the lowest out-of-pocket expenses. They typically cover about 90% of medical expenses, leaving the insured to cover the remaining 10%. In addition to these metal tier plans, catastrophic plans may be available to those under the age of 30 or who qualify for a hardship exemption. These plans have lower premiums but higher deductibles and fewer benefits. It's important to note that the specifics of health insurance plans can vary depending on the insurer, so before enrolling, carefully review the plan's benefits and costs. Things to know about health insurance in Mississippi. If you're thinking about buying health insurance in Mississippi, here are a few things you should know to make an informed decision. Mississippi has a federally facilitated health insurance marketplace, so residents can purchase health insurance plans through the health insurance marketplace at healthcare.gov. Individual health insurance plan open enrollment typically takes place from November 1st to December 15th each year. If you have a qualifying life event, such as losing your job or getting married, you may be eligible for a special enrollment period in addition to the regular enrollment period. Because Mississippi has not expanded Medicaid, Medicaid eligibility is limited to certain low-income individuals, such as pregnant women and children, as well as those with disabilities. Health insurance premiums in Mississippi can vary depending on a number of factors, including your age, tobacco use, location, and the type of plan you select. Mississippi has a high uninsured rate, with more than 10% of the population lacking health insurance. If you don't have health insurance, you may face a tax penalty unless you qualify for an exemption. Some Mississippi health insurance plans may have restricted provider networks, which means you may be required to see specific healthcare providers or facilities in order to receive coverage for your medical care. Consumer protections are in place in Mississippi to prevent insurers from denying coverage or charging higher premiums based on pre-existing conditions, as well as to ensure that individuals have access to essential health benefits. It is critical to carefully examine the details of any health insurance plan you are considering to ensure that it meets your healthcare needs while remaining within your budget. This is the next information in cheap health insurance in Mississippi. Quality rating of cheap health insurance in Mississippi. The quality of Mississippi's low-cost health insurance plans can vary depending on the plan and insurer. In general, lower-cost health insurance plans have higher out-of-pocket expenses, such as deductibles, copayments, and coinsurance. This means that while your monthly premiums may be lower, you will be responsible for a larger portion of your medical expenses when you receive care. The federal government has developed a 5-star rating system for health plans based on factors such as customer satisfaction, quality of care, and member outcomes to assist consumers in comparing the quality of different health insurance plans. However, not all health insurance plans are rated. and the rating system may not provide an accurate picture of the quality of a plan. In Mississippi, consumers can use healthcare.gov to compare plans and view detailed information about each plan's benefits, costs, and provider networks. Based on your healthcare needs and budget, this can help you make an informed decision about which plan is best for you. Furthermore, it is critical to carefully review the details of any health insurance plan and to ask questions if there is anything you don't understand.